Welcome to Module 8 of the NHS Insights programme, which will provide an introduction to business cases and value propositions. The learning outcomes of this module are to enable participants to understand what value proposition is, explore why value proposition is important, and also to learn how to build a compelling value proposition statement. Furthermore, participants will be able to understand what a business case is, understand why a robust business case matters, and explore the key components of an NHS business case. And finally, participants will be able to understand how a value proposition and a business case work together to support the adoption of new healthcare innovations. This webinar is one of a series of training modules in the NHS Insights programme. The aims of these different modules are to develop a culture of innovation, improve basic innovation-related knowledge, and empower all staff to be innovation aware and ready. The NHS Insights programme has clear aims to support the evaluation of innovations in real-world settings, to strengthen organisational innovation capacity and infrastructure, to build an innovation culture and talent pool, and also to pinpoint what works to lead to national practice. Innovation is at the heart of the NHS 10-year health plan. However, many promising ideas never actually move forward or get adopted across the NHS. As healthcare professionals, you may well have seen great ideas stall because the value was not clearly articulated or the case for investment or support was not strong enough. This module is about two practical tools that can help bridge that gap between a good idea and real-world adoption in health and care settings. In this session, we will focus on two essential tools that can help turn innovations into reality: the value proposition statement and also the business case. The value proposition helps you explain why the innovation matters to the specific end users or customers, while the business case helps you secure organisational support, resources, and also formal approval. By the end of this module, you should feel more confident about framing an innovation or even your own ideas, so that decision makers, funders, and colleagues can understand them, support them, and invest in them. We will start with the value proposition, because if you are not clear on the value that an innovation provides, it is very difficult to write a compelling business case. So think of this section as really shaping the story of the innovation from the perspective of the people who will actually use it or be affected by it. So what is a value proposition? A value proposition is essentially a clear articulation of the unique value that an innovation offers. A simple way to think about it is the innovation helps X do Y by doing Z, where X is the target customer or end user, Y is the benefit or problem being solved, and Z is the innovation itself and how it solves that problem. It is important to remember that a value proposition is not about how the innovation actually works. It is not a technical description of how the product works or its list of features, and it is also not a sales or marketing slogan. Instead, it is about truly understanding the customer, the problems they experience, and the impact the innovation or solution can have on their daily work, their patients, and also the wider system. You can think about customer quite broadly here. It could be, for example, patients, frontline staff, a particular trust, or an ICS, for example. A clear value proposition ultimately lets the customer know why they should actually care about this innovation. It explains clearly what the innovation offers, what the benefits are, and how it will change outcomes, workflows, or experiences, for example. It supports engagement and decision-making by making it easier for busy clinicians, managers, and boards and key stakeholders to quickly grasp the relevance of the particular idea or innovation. And this really matters because more than 90% of product innovations fail. Often not because the idea is bad, but in some cases because the value was not clearly understood or communicated. One practical tool for developing a strong value proposition is the value proposition canvas. And this really breaks down the problem into two halves. So on one side, you have the customer profile, what your customers are actually trying to do, the pains they are experiencing, and the gains or outcomes that they would like. And also the value map. So this explains how the innovation creates value by relieving pains of the customers and creating those gains and outcomes for the customers. And the aim really is to reach a fit between the two different halves, a situation where what the innovation offers clearly addresses the jobs, pains, and gains of its intended customers. But when we talk about fit, we are essentially asking, does the innovation genuinely address the customer's unmet need? On the customer profile side, we're essentially asking, what difficulties are those customers experiencing? What outcomes they actually want, and what need is not currently being met? On the value map side, we can add details about what the innovation offers and whether it improves or solves those issues in a way that is meaningful to those customers in practice. And this process can really help one avoid developing features and innovations that are really very interesting, but do not actually tackle the problems that matter most to customers in clinical and operational settings, for example. So the value proposition canvas really encourages one to look at the three key elements of the customer profile, those being the jobs, the pains, and also the gains. The customer jobs are essentially the tasks that they are trying to complete or the outcomes that they are trying to achieve. The pains are the obstacles, frustrations, risks, or negative outcomes those customers are experiencing in trying to do those jobs. And the gains are the positive outcomes that they want. So they could be, for example, better patient outcomes, smoother workflows, time saved, reduced errors, or improved staff and patient experiences. And in designing or refining an innovation, you can then map specific pain relievers and gains creators. So what the innovation does to essentially remove those customer pains and frustrations and create gains and positive outcomes for the customer. And to build the value map, you directly connect the solution to those jobs, pains, and gains. So we can ask, does the innovation meaningfully help with the jobs that we have identified, relieve the most important pains, and create the gains the customer actually values? And this is where one can really refine your idea or innovation, and perhaps drop features that do not contribute to the value, and strengthening aspects that address the most pressing customer needs. And working through this with perhaps clinicians, with patients or managers early on in the process makes that conversation about perhaps piloting or adopting an innovation much, much easier. So once you have understood the customer profile and the value map, you can turn that into a concise value proposition statement. And one useful template is shown on the left-hand side of the slide here. So our, and then you can fill in what the specific product or service is, helps, and then you can add in the specific target customer who want to do specific jobs, or what is their specific unmet need that they're experiencing. By, and then here you can add in more information about how the innovation can help reduce the pains and frustrations of the customer. And then you can add in what the innovation does to help the customer achieve the outcomes that they really want. And then unlike, and you can perhaps add in here some information about competing solutions and how they don't address the customer's specific unmet need. And this ultimately forces one to be very specific about who the innovation is for, so the specific customer and customer segments, which unmet need the innovation is tackling, and how it is different from current approaches or competitors, for example. And it's important to remember as well that the value proposition statements can essentially be a living sentence that can essentially be refined as one tests and learns from real world feedback on that innovation. So on this slide, using the template that I just showed before, here is an example of a value proposition statement in a healthcare context. So our wearable device and app helps individuals managing chronic conditions who want to have real-time monitoring of their condition and personalised alerts by reducing confusion about their condition and unnecessary GP or hospital appointments, and empowering convenience and proactive self-care, unlike standard devices that require periodic readings to be taken. So you can see here, it's very clear from the structure that the target users are clearly described. The unmet need around managing chronic conditions via real-time monitoring and better understanding is clearly articulated. The pains, which are confusion about a patient's condition and unnecessary appointments, is clearly laid out. And also, so are the gains in terms of convenience and really empowering proactive self-care. So you could substitute your own idea or innovation essentially into this template. It could be, for example, a new digital tool, a new clinical model, a new device, or an AI-enabled triage system, for example. And you can use this same pattern and template to really create a crisp and clinically relevant value proposition statement. So once you're clear on the value proposition, the next step is to build a robust business case. In the NHS and across public services, business cases are the standard way to really justify investment, explain options, and secure approval for change. So what is a business case? So a business case is an important document that really sets out the rationale for initiating a project or making an investment in a new product or service. And it really explains the value and benefits the organisation will gain, and really outlines the why, what, how, and who the proposed change is for. And done well, it really brings together the evidence on need, options, costs, benefits, risks, and implementation so that decision makers can really make an informed choice. So why does a robust business case matter? Well, it really provides a structured framework for decision making. It sets out the evidence, analysis, risks, costs, and benefits all in one place, and aligning expectations across numerous different stakeholders, including clinical, operational, financial, for example. And it can really be used to secure buy-in for procuring a new product or services, to gain approval for a collaboration or pilot study, for example, or to seek external investments and support. And in the context of constrained budgets and workforce pressures, a clear evidence-based case is often what differentiates an idea that progresses from one that does not. So the NHS typically follows a standard approach to business cases based on the 5-case model, as you can see here on the slide. And it is worth mentioning here, though, that your own organisation may have a particular preferred template that they wish to use. Though the contents will often be very, very similar to what is shown in the 5-case model. And the health innovation networks actually recommend this 5-case model as a standard template for medtech business cases in NHS trusts. So looking more closely at the 5-case model. So the 5-case model includes the strategic case, the commercial case, the economic case, the financial case, and also the management case for any procuring of new services or products or some other element of change within an organisation. And the strategic case really explains the case for change and how it fits with perhaps national or local priorities, for example. The economic case examines the options and identifies which innovation or solution offers best value for money and the greatest net benefits ultimately to patients and the system. The commercial case covers how the solution will be procured or contracted, including any supply arrangements and also commercial risks. The financial case looks at affordability, funding sources, how will this work be funded, cash flows, and the impact on budgets over time. And the management case sets out how the project will ultimately be delivered, governed, and evaluated, including any milestones, responsibilities, and also risks. Within NHS organisations, business cases are typically prepared by the general or divisional manager of the relevant clinical area, often working closely with clinicians. And this could also include contributions from finance, procurement, digital, information governance teams, and sometimes also from the company as well that may own a particular innovation. If the business case is approved, standard trust procurement rules often then apply, which may require competitive quotes or a full tender process, really depending on the value and nature of the particular project or investment required. So understanding these processes early really helps you to shape your proposal in a way that is realistic and compliant, and also easier for the organisation to understand and also progress. So included on this slide are some further resources for further reading if you're looking to develop a business case or value proposition. And so finally, really, the key takeaway from this session is value proposition and business cases can really help to accelerate innovation. The value proposition explains why the innovation ultimately matters to customers and end users and helps attract interest. And the business case is an important document that explains why procuring a new innovation makes sense financially and also strategically, and can help secure commitment within your organisation. So these two important tools can really help to increase the chances that good ideas translate into real benefits for patients, staff, and also the wider system. So thank you for watching this video. If you would like to get involved or find out more about the NHS Insights programme, please visit the website as provided on the slide. And you can also contact maybe your local innovation team or leads in your own organisation or ICB where appropriate. Thank you for listening.